Hi, I'm Dr. Dan, your Biohacking Veterinarian. Today we're talking about pain in your dog, something that no pet parent wants to see. Pain can significantly impact your dog's quality of life, and understanding it is the very first step toward effective management. Let's break it down. There are two different categories of pain: acute and chronic. Acute pain comes on suddenly, often due to injury or surgery, and usually resolves as the body heals itself. Chronic pain, on the other hand, persists for weeks or months or even years and is often associated with conditions like arthritis. There are also two different types of pain: inflammatory and neuropathic. Inflammatory pain is caused by tissue damage, leading to swelling and discomfort. Neuropathic pain, however, is caused by nerve dysfunction or damage, like a pinching of a nerve. For inflammatory pain, we have medications such as nonsteroidal anti-inflammatories, NSAIDs, like Rimadyl, Carprofen, Metacam, Previcox, or Galliprant. And we also have corticosteroids. However, natural options such as omega-3s, fish oil, boswellia, turmeric, enzymes, and even arnica can also provide anti-inflammatory relief. Neuropathic pain, on the other hand, often requires medications like gabapentin or opioids like tramadol or the new drug Librela. We do have natural alternatives including PEA and CBD that work on nerve signaling pathways to block pain. Other drugs like amantadine and amitriptyline, they address the broader pain mechanisms, and then there are emerging therapies such as peptides and exosomes. They not only help manage pain and inflammation, but also promote healing and restore balance. Of course, there's other therapies that do not require your dog to swallow something, such as acupuncture, laser therapy, pulse electromagnetic field therapy, PEMF, rehab exercises. These can significantly help with pain as well. Now, what about Librela, a monoclonal antibody treatment marketed for pain management in dogs? While it sounds promising, the FDA has issued a warning about it, about the neurological side effects, which include wobbly, weak hind legs, called ataxia, seizures, paresis, like paralysis, urinary incontinence, and in some cases, even death. I've been talking about this drug for about a year, and I've personally seen multiple cases of dogs with weak hind ends to the point they can no longer walk after only a shot or two. Let's take a closer look at how Librela works and why we need to be cautious. As I said, Librela is a monoclonal antibody. That attacks nerve growth factor. Or NGF as it's called. NGF is a protein that's critical in the pain signaling process. It binds to receptors on nerves and to transmit pain signals. For example, if you had something happen that is a painful response, nerve growth factor goes to that area and signals, hey, there's pain here. How does Librela work? Is Librela's antibodies attached to nerve growth factor. They latch onto the NGF and prevents it from attaching to those receptors because it has these antibodies. Now it can't attach to the receptors, thereby reducing pain because it blocks the signal. However, it does much more than just signal pain. It plays a vital role in multiple essential functions in the body. And that's what some of the problem is. NGF doesn't just do pain. It does other things, such as keeps the nervous system healthy. NGF supports the growth and repair and maintenance of neurons, ensuring a healthy nervous system. One of the other things, It helps with immune system regulation. It influences immune cells like mast cells and T cells, and it helps modulate inflammation and facilitates tissue repair, which is another step. It plays an important role in wound healing. It promotes the growth of epithelial and endothelial cells, which is the component of faster wound healing and improved tissue regeneration. It also aids in the formation of new blood vessels during recovery. It's apoptosis. One of the things that it does for people for sure, and also in dogs, is cognition and neuroprotection. NGF supports memory and learning by maintaining cholinergic neurons in the brain. Deficiencies in NGF have been linked to neurodegenerative diseases in humans like Alzheimer's, or in dogs, canine cognitive disorder, dementia. Very critical here, it balances nervous system of the heart. It plays a critical role regulating the autonomic nervous system, controlling the heart, ensuring the proper balance between the sympathetic and the parasympathetic nervous system. If that becomes unbalanced, you have sudden death. And it also helps with tendon and ligament repair. NGF indirectly supports collagen synthesis, a key component in repairing and maintaining connective tissues. We've been having a rash of ruptured Achilles tendons and cruciate ligaments in these older dogs getting Librela. Is that because there's a lowered amount of NGF, or is it because the dogs feel better and are using it more often? Anyway, these are 6 systems that the dog needs NGF for, and Librela is blocking it. So it's a veterinarian's job to weigh the risks and benefits of every treatment. Librela may be a good fit for some cases, but it's crucial to approach it cautiously. This drug is used as a quality of life option for patients with severe arthritis and should not be used as a generic pain medication. It is vital to select patients appropriately and carefully. Librela should never be given to dogs with neurologic impairments, whether they're spinal or cognitive. Also, it should not be used as a first-line therapy for dogs with arthritis. Consult your veterinarian about alternatives, safer alternatives, and consider integrating natural options to support your dog's health holistically. You'll be better off for it, especially when the beginning signs of arthritis. Together, we can keep our pets healthier and happier. To learn more about managing pain in your dog, visit my website, Biohacking for Dogs. Thank you for watching, and keep your dog thriving, not just surviving.